Senator Murray.
Well, thank you very much, Mr. Chairman, for holding this really important hearing today. There really is no issue as pressing as providing quality, timely mental health care and suicide prevention programs to our nation's heroes. The problem is familiar to everyone here, but as Senator Moran said, the solutions seem sort of elusive, and we need to focus on that. Senator Walsh just testified, as we all know, 22 veterans die per day because of suicide. And I think it's important to note that rates have continued to increase among female veterans who use VA care, and among male veterans who are 18 to 24 who use the VA, the rate has skyrocketed to 79 per 100,000. And according to VA's access data, wait times for new mental health patients has been virtually unchanged. It is still 36 days over the 5 months that the VA has provided us the data. So I'm very concerned about whether the VA and local communities are prepared with the resources and policy and training to help our veterans in serious crisis. We all know when our men and women in uniform have the courage to come forward and ask for help, the VA has to be there not only with high quality and timely care, but the right type of care to best meet the veterans' needs. So we've got to demand progress on all those areas. And as has been mentioned, we passed a new VA reform bill to help veterans get care just a few months ago. It included a temporary authority to improve access to community providers for veterans who are having trouble accessing VA care. But a recent report by the RAND Corporation raises some serious concerns about whether private sector providers are ready to give high-quality care to our veterans, and suggests we've got to do a lot more to expand use of evidence-based treatments and a lot more to help providers understand the unique needs and the culture of our service members and our veterans. The reform bill included some critically needed funds to build and strengthen the VA for the long term, but there are a lot more needs going forward. The VA has got to start planning and requesting the necessary resources now so it'll be prepared to meet the growing demand for mental health care far into the future. So there is a lot more work to be done. Just one suicide, just one veteran in crisis, or just one family struggling to make it through is just one too much. So I, too, want to thank you for this hearing, and I want to thank Mrs. Selke and Mrs. Pilata and Mr. and Mrs. Venata for being here today. It is incredibly difficult to talk about these issues. So we all really admire your courage and your strength for being willing to be here to share your stories with us today, because it is those stories and our understanding of that that will keep us focused on this, and I really appreciate it.
Senator Murray, thank you.